your childhood illnesses, you had the chicken pox. What about any accidents or injuries during your lifetime? No fractures, penetrating wounds, head injuries? Okay. Any chronic or serious illnesses such as diabetes, hypertension, heart disease, hepatitis, anemia? Any past hospitalizations?
To get my tonsils out.
Tonsillectomy, and when did you have that?
Probably when I was 12.
Oh. And what was the reason for your tonsillectomy? Did you have strep a lot, or any inflammation?
I must have sore throats a lot or something, but I don't remember.
Okay. And what about any operations?
No.
No past operations. What about immunizations? Have you been vaccinated?
Current.
All current?
Yeah.
Okay. And when was the date of your last exam, your last physical?
Last year.
2013. What about a dental exam?
Last year.
Okay. Vision?
Last year.
Hearing?
Last year.
EKG?
I haven't ever had. Well, no, I haven't had one.
Chest X-ray?
20 years ago. 1993.
What about your past labs, like cholesterol, any blood labs?
Last year.
Last year. Okay. Great. What about allergies? Do you have any
Seasonal allergies.
and that's outdoor allergens?
Mm-hmm.
No food allergies or medication allergies?
Penicillin.
Penicillin.
And codeine.
Okay. And what occurs when you do take those medications? The rash,
I'm
itching,
nauseated.
watery, nauseated. Okay, what current medications do you take?
None.
None. And that includes over-the-counter and prescription?
Yes.
Okay. What about family history of diseases or any health problems?
Disease and cancer.
Heart disease and cancer. And
On both my mom and dad's side.
okay. Maternal and maternal. Are both your parents still living?
Yes.
And what chronic illnesses have they been diagnosed with?
My dad just heart disease.
Okay. Do you have any living grandparents?
Nope.
Any children?
Yes, 2.
So have you had any changes in your skin? Any pigment discoloration? Any rashes, wounds, open sores?
No.
What about changes in hair?
No.
Nails?
No.
Have you had any head injuries? Any? Okay. What about eyes? Any difficulty with vision? What about ears? You have hearing loss?
Yes.
Hearing loss?
Yes.
Do you wear hearing aids?
No.
Do you have recurring like ear infections or any discharge? Ringing. Are you exposed to any environmental noise? I assume on the fire rig you're exposed to that loud engine.
Mm-hmm.
Does that exacerbate your hearing, your ringing or anything?
No, they ring constant.
They ring constant, 24 hours?
Mm-hmm.
Nothing that relieves the ringing?
No.
And when was your last hearing exam? You said last year?
Mm-hmm.
And were they able to do tests or reach conclusions about what was causing that?
They just said that I have hearing loss.
Hearing loss, okay. Any nose issues? Any swelling, discharge,
No.
bloody noses?
Mm-mm.
Okay. What about mouth and throat?
Fine.
Fine. Okay. Any neck pain?
Yes.
Yes. Is that related to the pulled muscle in your back?
Yeah.
Does that cause a limitation in the range of motion in your neck?
It's hard to move.
It's hard to move. Do you have any swollen glands in your neck?
No.
About respiratory issues? Any trouble breathing?
No.
Are you exposed to a lot of toxins on the job? Does that, like the smoke?
Sometimes.
Does that make it hard for you to breathe?
No, it just makes my sinuses flare up.
What about any chest pain, palpitations? No. Have you been diagnosed with hypertension, coronary artery disease, anemia? Do you have any pain or swelling in your legs?
And they hurt at night.
Your legs hurt at night. Is this every night?
No, not every night. Just probably 80% of the time.
And
They just ache.
they ache. And that's constant throughout the night?
Well, I always take ibuprofen to...
So you do take over-the-counter medications?
Well, when I need to, yeah. I'm not taking any now.
Okay. Okay. So with those leg pain, have you sought help in the past from your doctor?
Well, I talked to the doctor about it. I just said it's because I was real active.
Okay. Are you having any stomach pain, nausea and vomiting,
No.
food intolerances? How's your appetite?
Fine.
Fine. Do you have a good appetite here at the station, eating with all the meals and the other guys? Okay. You'd say good appetite. And when was your last bowel movement?
This morning.
Was it soft? Hard?
Soft.
And what color?
Brown.
And no blood in your stool or...
No.
Okay. Any pain with urinating?
No.
History of kidney disease? Or...
No.
Okay. How about your sexual health? Are you sexually active?
Mm-hmm.
Yes. And you said you were married. Is that a monogamous relationship?
Mm-hmm.
Have you been diagnosed with any STDs?
Nope.
What about joint pain? Do you have any stiffness, swelling?
Just in my neck and back.
Okay. But not at your joints, arthritis?
No.
Neurologic, do you have any seizures? Have you had tremors? Any past history of loss of consciousness?
No.
Okay. Any bleeding problems? Bruising? And no changes in your appetite, hunger, thirst, urination? Okay. We are almost done. Thank you for your patience. Do you have any problems completing your activities of daily life, like your brushing your teeth, bathing?
No.
Is that causing any? That's not causing
No.
any limitations in anything you can do
No.
that you're required to do to eat or
No.
drink or? Okay. What about in shopping or driving? Is that hinder any activities that you normally do that it's not allowing you to do? Okay. Is the pain stopping you from seeing your friends or doing the normal social activities that you normally do?
No.
No. Okay. What about activity and exercise? Have you stopped exercising since? So you no longer exercise?
No, I'm not exercising today.
Did you exercise yesterday?
No.
Okay. What about sleeping? Is that causing you to lose quality of sleep?
No, I slept all right.
Okay. Do you have spiritual resources that you can call on when you need it? No. Okay. What about coping and stress management? Is there someone here that you can talk to about stress on the job, maybe relating to the back pain? Okay. Do you use alcohol?
Occasionally.
How many drinks would you say you have a night?
Well, I don't drink every night, so 0. But when I do, probably 4 to 6.
4 to 6. And how often would you say you do drink?
Twice a month.
Okay. And no illicit drugs?
No.
Street drugs? Intimate partner violence?
No.
Can I get this? Excuse me real quick, sorry.
Oh, you're okay. What about occupational health? What about occupational health and hazards? Are you do you feel safe with everything
Yes.
you have to do on a
Yeah.
daily basis here at the
Yeah.
fire station? Okay. And what are your concerns right now related to your back or your health?
Oh, no. It's just aggravating.
Aggravating. Okay. And what are your goals related to your health and your
Just to get better.
back pain? Okay. And what are you anticipating that your doctor can do for you to relieve your back pain?
Just probably rest.
Rest. Okay. Well, thank you, Mr. C. And that concludes our health assessment.
Thank you.